Hi guys, good evening. Sorry, just had some technical difficulties earlier. I'm just going to be waiting for more people to join in. Hi, good evening, Dhanashri. Hi, Ruchi. Hi, Tejas. So today's session is going to be about women's reproductive health, and our expert for the session is Dr. Aakriti Gupta. She is a gynecologist and an infertility specialist. So I'm just waiting for her to join in. I think Dr. Akriti is having some technical difficulties. Okay, she's joined. Hi, good
Hello.
evening.
Good evening. How are you?
I'm good. How are you?
I'm fine.
So, welcome to this live session, and we're super grateful for you for doing this with us. Um, and we have a bunch of questions asked to us
Yeah.
by our community and our users, and I'm sure they're going to take away so much from this session. So we'll just dive right into it.
Yeah, sure.
So, Dr. Akriti, tell us a bit about yourself. Like, did you always dream about becoming a doctor? That you a gynecologist at that?
I never dreamed of a gynecologist, but yeah, since my both parents are into medical profession and my aunt and my uncle, they're also into same field. So maybe because the environment at home was all kind of medicos, so I never thought of some other profession. So it was something which was like more of a familial thing than kind of a sporadic thing for me. So what I did was I started doing medicine, but gynecology I never liked that much. I always dreamt of being a dermatologist. So finally we have a system of such, you have to attain this much number, entrance is there. So it's on the basis of your rank. So I couldn't get through dermatology, so the second option left was gynecology for me. So that's how I took gynecology. But then I always thought in gynecology I would always specialize in infertility. And I selected a sub part of it and chose it because I always had interest towards reproductive medicine. That's how I chose infertility as a career. And though gynecology was never made my career, but yeah, in gynecology, but while doing my 3 years post graduation, I felt attracted towards reproductive medicine. So that's how I ended up being an IVF specialist.
And I think we're super grateful that you're doing it, because I'm sure you're helping so many people by, specializing in infertility and
Yeah, correct,
helping,
correct.
become parents and so on and so forth. So first things first, like, when should one see a gynecologist for the first time?
See, like what happens here in India, this thing is not quite common, but it is quite common in the American or the European population. And we have guidelines, even like the ACOG, which is the Obstetric Society of America. It recommends that once, she has her first periods, so she should be taken to a gynecologist for two reasons. Once she opens up, she becomes more comfortable with somebody who she knows as a medical advisor, and she can talk on some issues later on once she feels comfortable enough. So that's first, to make a repo. They want to take the girl once she has menstruation, and menstruation once starts, there are so many things she has to be told, and a medical advisor telling her those things rather than the relatives or the mom is much healthier way to talk about, and that will actually have a better impact on the girl as such. So I think it should be started in India as well, because I don't think, and I have not myself been taken to, I don't know whether you were, but I don't think it is still a thing in India. But abroad it is actually mandatory, and it is, the guidelines are there, and we don't have any such guidelines.
Thank you for enlightening us on that, because I think it is important, and none of us were taken to one, and I'm sure things would have been more comfortable if we were taken to a gynecologist than
Yeah,
we
true,
answered,
true.
spoke about all of this. So coming to vaginal health, what is normal when it comes to vaginal discharges, and how can one keep their vagina clean and prevent infections? And
Usually, if you talk about vaginal discharge, there are few properties which has to be seen. That normally also vaginal discharge will be there. So what is actually it normal one? A normal one will be, it will be white to off white, transparent color, and the consistency will be fluid like, and it would not be sticky or foul smelling. It will have no smell and odor. That means it will not have any odor, and the quantity will be so minute that you will not find its traces. It will be something which will be there in your vagina. So when you start and find the traces, like you find the panty getting soaked, and you find any abnormal color, yellow or maybe greenish yellow, or maybe off white, or you find a red color, blood kind of a thing mixed with blood, like brownish discharge. So you start seeing the changes, and you see that it is different. So then you say it is an abnormal discharge, or you find the smell getting changed, there is some odor, specific odor to it, the texture has changed, the consistency has changed, the amount has increased. Okay, so those things will lead to a pointer that, okay, you need to meet a doctor and get yourself examined, so that you can take care of what kind of infection are you suffering from. Then there is one more thing. Even sometimes the discharge is normal, but it is more. So those are few points, like while ovulation, when there is a mid cycle of a lady in the period cycle, so that time there is excess production of estrogen in the body. That time it is normal. The consistency amount, the amount might be little more, so you might wet your panty, but the rest of the features would be okay. So that means it is normal, but it is increased. Then if you are taking the contraceptive pills, the 21-day course, that time also you might have these. And in pregnancy also you have this. So these are kind of the physiological causes, you can say, which a lady can have excess but normal discharge. So this is normal and abnormal. And when you talk about taking care of your vaginal health, I think there has to be good amount of there's a bacteria called as lactobacilli, which maintains the acidic environment of your vagina. And so for that, we tell you to have more of a probiotic diet, more have curd in your diet, or if not, then have more of lactobacilli. There are in bacillus forms, in capsules, in respules formulation. Many times doctor advise you to take that. So that will keep you in the vagina, the area will have good amount of those bacteria. They are the healthy bacteria. They keep that acidic environment and they prevent infections. You can also use vaginal wash, although it is just a placebo. They have the same pH as your own vagina. So rather than using soaps, you have to use a vaginal wash and not use water, because that has a neutral pH of 7. So those pH has to be balanced again, and always clean your vagina from front to back, because if you do it from the reverse order, you're going to have the infection from the backside, which is your fecal matter can be there, those things can be there. So these things have to be taken care of. And also vaginal health, for that reason you use a cotton panty and drink lots of water, have more of probiotics in your diet. So these can be the ones which can be taken as a preventive things for keeping good care of your vaginal health.
I think there were some great pointers out there. So next question is that, how often should women get their breast examinations done? And is there any way that we can do our self breast examination?
Yeah, exactly. So usually after 40 years of age, what it is told is that once or twice a year they do mammography. That is something which is an X-ray for the breast. So if you don't do that, leave it. Every month, at least once, you go for your own self breast examination, which is actually economical, good enough, indicator for screening of breast diseases, not just cancer. And it is something which is so easy to do. It is just you have to take guidance from your doctor, and whenever you do take a shower, and in front of the mirror you have to stand, and there are 3 positions in which you have to do it. So you can do it at least once a month. That's very economical for anybody to do it, because you are definitely going to take a shower daily, and just sparing 10 minutes in 1 month is not it's not going to take any time of you, neither money. So that's the best way, having self breast examination monthly once.
I think everyone should note that, all the women out there, because it's important to take care of your body and see if there are any changes.
Even
And
if you don't go for a screening to the doctor, doing this is much easier and even more convenient. So I think
absolutely,
this should be done.
absolutely. So now coming to the next question, which is about periods, and all of us, pretty much almost everybody, experiences cramps. So what is like the best way to treat period cramps, and what can one do if they see that the cramps are getting worse with time and with age? Could there be a reason for it?
Yeah, first of all, period cramps, 90% of the girls, they experience primary dysmenorrhea, what the term is, which is actually means that once the period starts coming, the pain will come, and once they, in next day, maybe in a day or two, it goes away. So these are the most common type of dysmenorrhea, and you have it in 90% of the women. However, there is one which is secondary. That means it starts prior to the periods and it continues even the period. I have, like 1 or 2 days. If they are for 3 days, 4 days, it will continue with that. So that means it is a disease pathology, and you have to meet a doctor and consult that if some kind of thing is happening. This is when it is either secondary. Then second thing is if it is more, like it is excessive, you are unable to tolerate with a basic analgesic medicine which normally everybody has over the counter by the name of peptal spas at home. So if you're not able to treat it with that, definitely there has to be some other reason for it, or it could be just primary dysmenorrhea with headache, with nausea, vomiting, with bloating, so many symptoms combined. That time also you need to meet a doctor. They will put you on certain medicines, basically hormonal pills, and that will take care of your dysmenorrhea. So taking medicines is not bad. Definitely we have in Indian mythology a lot of medicinal herbs which we use at home, like ajwain water or zira water. And many times the ladies will have coffee, these things kind of which they are there something in the tradition, and they will feel even they're using these what do you call cramp relief. Nowadays we have those cramp relief pads and all, no, heat pads. So, but we were using hot bottles. So these are something which were indigenous to us. So those are things which you can try at home. But still, if you're not getting relief, try a simple analgesic, spasmodic, and then it's still not working, then you have to meet a doctor. She'll put you on drugs. So that's not a problem. You can definitely take.
All right. I'm sure that's reassuring to a lot of people, girls and women out there. So my next question is like, is it safe for having unprotected sex if one is on their periods? Can people get
Uh,
pregnant?
no, no, it's not safe to have sex during periods, not because of pregnancy, but it is mostly because we have a term called as endometriosis, where the blood, which is the blood which is flowing from the uterus, if it flows in the reverse direction, means in the sense like if somebody is having sex during periods, so it is presumed that it will travel in the reverse order, and it will go and travel to the fallopian tubes into the cavity of the abdomen and land up on the ovaries or something like that. Maybe not the bulk quantity of blood, just the spots, or the spots or minimal amount of blood will transfer in that sense, and that might give to a disease. It may give rise to a disease called as endometriosis, so which is a very painful disease. Also there are commonly known as chocolate cysts in the ovary, so that has a very painful periods, problem of infertility, a painful intercourse. So this is how that disease arises. This is the most common way which we presume as a theory, and we say that it arises in that sense. So I will never recommend my patient to have sex during periods, although many people are now promoting it and they're telling that it's safe. But for this reason, being a medico and studied that reason, I would never recommend anybody going for period sex.
I think that's super enlightening because I had no idea about this either, and especially painful conditions like endometriosis can happen because of this. It's I mean, thank you for sharing that. So coming on the same topic, what are some of the birth control options available in India? What are some of the safe ones that women can take?
Birth control options, we have two options. One is spacing, okay, and the other is we want to have a long gap. Okay, so the third is emergency contraception. So when we talk of birth control, we actually talk about the measures which are short term and long term, and emergency contraception usually doesn't come in that, because emergency is something which has already happened and you are taking a medicine, and birth control definitely means that you have to do a spacing or it's a long gap. So when you do emergency contraceptive pills, we have by the name of iPill, which has progesterone in it, and which is also called as unwanted 72. So this means that you can consume it in within 72 hours of unprotected intercourse. So besides there, you have even Saheli, which is available by the government of India, and many people don't know it, that it is also a emergency contraception, and it can be taken up to 5 days of the unprotected intercourse. Some even copper tea, which is also available by the government, made available by the government at customized prices, that also acts as an emergency contraception, but people are not aware of it. So these three options can be used as emergency contraception. And if you want to space and take a birth control pill for a longer time, like 3 weeks, you have to keep on taking it till the time you want the birth control. So that is available in the form of many brands are there. But even if you talk about government of India, so we have Mala D, Mala N, which is readily available in the PHCs or the CHCs to the common man, common public. Otherwise, there are so many brands which are there in the market. And again, other options again is copper tea, which has a spacing of 3 years, 5 years, 10 years. So you can choose whichever you want. So we have various birth control options, and it is actually your preference. You want to space it for how long, and whether you want an emergency contraception or what. But these two can't be used, interchangeably.
Okay, okay. And I'm sure there's a hormonal IUD as well, right? That's also available in India.
Yeah, that is called LNG or Mirena, and that one is a costlier one, but usually it is used rather than a hormonal contraceptive. It is more often used for conditions like painful periods, like I told you, endometriosis, and heavy menstrual bleeding because of same adenomyosis. These are different conditions where we use it as a double purpose. One, to have a gap of pregnancy. Secondly, also to take care of your imbalance in the hormones in the body. So it has dual purpose. It's quite useful.
And since you were talking about emergency contraceptive pills, are they like really effective, and can there be like a failure rate even in them?
There
Like,
is there is there is a failure rate. Definitely, there's a failure rate. Will always be there, 1 to 2%. But definitely they are safe. But you should have a limit. It is not that every month you are having unprotected intercourse and you're going to take that. So twice or thrice in a year it is allowed, but not beyond that.
yeah, I think because of advertising and
It's always
marketing, a lot
safer
of,
to use a protection, physical protection, rather than going for this emergency contraception.
yeah, a lot of girls have this misconception of just taking that pill
That's going
as
to
form
harm
of,
the hormonal balance in the body if you take it so much.
yeah, yeah, yeah,
Because I
I
have
put
seen patients with the irregularity in menstruation after taking pills, this pills for 2-3 times together. So they'll have irregular periods after that.
interesting. So I wanted to now talk about PCOS. Like, how does that affect one's fertility? And what can one do if they have PCOS?
If you talk about PCOS, basically polycystic ovarian syndrome, it affects so many things on the besides the ovary itself. So in ovary, basically the eggs which are formed, so their quality actually deteriorates because of the high androgenic environment. High androgenic means high male hormones will be there in the ovarian environment, and they will have a negative influence on its growth and even the quality. That's the one reason how it affects. Second, the uterus lining is affected. There's a lot of inflammation around in the body, around the uterus, around, so because of which there will be negative effect on the implantation of the baby. That was again another way it leads to infertility and fertility issues. Besides that, there is increased risk of abortions in these patients because of the same very reason of inflammation. And also fourthly, there is the cervix, that is the outer portion of the uterus, that is supposed to be weak. There are the tissue is supposed to be weak in women who have PCOS, so that leads to increased risk of abortions again. So there are various ways in which it affects your fertility, starting from not getting pregnant to getting abortions. So this is how PCOS affects it.
And how can, what are the treatment options available for PCOS? What can
We
women
have
do?
options available for infertility, like we have egg forming tablets, and we give them for the formation of eggs. And then we have higher approaches like intrauterine insemination, and third, we have IVF. So this is how we go in a pattern. We follow the minimal one first, and then we go to the second one, and then we go to the third one. And for preventing abortions, many doctors, they put a patient on progesterone support, or sometimes even a cervical stitch is applied. We apply a stitch on the cervix so that there is prevention of abortion. There are two measures which we can take.
Mhm. Since you're an infertility specialist, I wanted to ask if there is like any right age for a woman to get pregnant. What are some of the common problems that women face when it comes to getting pregnant? Is there
Basically,
a
what
right
I no, there's actually a video I did on this, that what is your ideal age of getting pregnant. So basically, the ideal age is, if you talk about a biological age, that is 20 to 30. Okay, or age of a lady. However, the ideal age, if you take into consideration the perspective of the lady, so it is actually when she's physically, emotionally stable, and she's financially stable, she thinks she wants a child, that is exactly when she should get pregnant. But then a biological age might not match with her priorities, so that might be a clash.
age? My next question is about fibroids. Can they affect one's fertility, and can one person get pregnant if they have fibroids?
Yeah, definitely. If they have fibroids, because there are three different types of fibroid depending upon where they are. If they are into the cavity of the uterus, so it will hinder, fertility. It will hinder the pregnancy also, and it might lead to abortions. And if it is in the uterus itself, in the muscle tissue, so it might not cause any problem. Also, if it is outside the uterus, majority of it, then also it is less likely to cause a problem. But it also depends upon the size. If it's quite big, that it might push, the in the formation of the baby, or it might push the baby who's growing in the uterus. So then it might create a problem. So it depends upon the location also, the size also, and the number also.
Okay. And if, say, a woman has a big fibroid or lots of fibroids, should she just conceive
No,
naturally,
no,
or
no.
should she go
She should
for
try it
surgery
and
and
remove it first, and then try naturally.
okay, okay. So do you have any tips for good reproductive health that women can follow?
Yeah, definitely they should have, good probiotics in their diet, first of all, to take care of their vaginal hygiene by wearing good cotton panties, and like I told you, use intimate washes, and not use just soap. Don't use soap at all. And they should have a protective intercourse. Okay, use physical barriers. Don't have multiple sexual partners, and drink lots of water. Those things which usually, and not wear tight clothes during summers and monsoons. Those will increase the risk of fungal infections because of humidity. uh, we have during that season, wear airy pants, loose clothes, those things.
I think there are some great tips. And my last question, and certainly not the least, is there any motto that you live by, and if you have any message for all the women out there?
um, Motto keeps changing actually. As you grow, your motto also keeps changing. But yeah, there's always something. But that's what my parents and my better half says always, that whatever you leave behind, there's always something which is coming up ahead, which is much brighter than what you've already left. So just go ahead and look out to that, not what you've left behind. So that's what currently, that's the motto I follow.
I think that's an awesome motto to live by. So I'm just going to see if any of our users have left some questions for you, and you can maybe answer them. Okay, we have Manmeet who asks, why does menstrual cycle change after marriage, even after having safe intercourse?
No, no, it doesn't. It doesn't. It's just the psychological, things that are changing around you. Maybe the change of place and work, or the environment, and you were put under so much of stress. Change, because it's a change of home. It's a change of, personality also. Meeting new people. So it's kind of an emotional thing, and your hormones have a balance between brain and the ovary. So if there's the balance is interrupted, definitely something happens to your periods, and that's quite often I've seen patients complaining after marriage. They became irregular. First two cycles it became irregular, but before they were coming regular. But I think it's more of the environment and the mental status. But I think nothing of this sort happened to me anytime. I also got married. I never faced this problem.
I think it's great that you pointed out that emotional health can really affect one's physical health.
Yeah, if you have your relation of the hypothalamus and your ovary, so everything has a link here.
Absolutely. Um, Richa says, I'm trying for second baby for the last 5 months. Sometimes I feel pregnancy symptoms, but at the end I got the period. Is
That's
that
just your psychological thing. You're feeling the symptoms, because if there's pregnancy, then definitely it'll be there. It won't go with periods. Okay, periods will come only if there's no pregnancy.
all right? Guys, if you have any more questions, please drop them in the comments below. So Dr. Akriti, I had this question. What is exactly a UTI, and how can one prevent, recurring UTIs? Because this is another thing that a lot of women, I'm sure, face.
Yeah, basically urinary tract infection. That is something which is concerning the urethra, the bladder, and if that gets infected, so that we term as a UTI. And how can you prevent it is by same few things are like unprotected intercourse has to be avoided. You should have not multiple sexual partners should be there, and if you're using you should use condom always. And besides that, whenever you clean the area, your vagina, clean it from front to back, and drink lots of water. If you have intercourse, immediately after intercourse you should have water, glass of water, to flush away the toxins. This is because the vagina is quite short and the urethra is also very nearby. So the urethra is very short in females and it is very close to the vagina. So what happens is many people after having intercourse, they suffer from UTI. So that's because of the close proximity of the two things, and also because the urethra is quite small, around 4 centimeters only. However, it's quite longer in males. So you don't see males suffering from UTI that often. Otherwise, if you see them in females, that's the only reason for that. Okay, so you keep yourself hydrated, flush your toxins and all, and that's way how you can prevent it. Otherwise, recurrent UTIs we usually will label if there are more than 3 episodes in a year. So if there are 3 episodes in a year, then the patient is labeled as recurrent UTI. However, you can prevent a second episode of UTI if you know that these precautions can be taken. And also you can have, there is products are there in the market which have cranberry extracts, and you should be like sure whether it's actually containing cranberry or it's just simply sugars. So that is also helpful in preventing the E. coli bacteria to stick to the urethral walls and the bladder walls. So it will also prevent UTI. So there are various products in the market. Other than that, they have D-mannose combinations that also helps in the similar fashion. So this is how we can, practically also prevent it and use a few products which are not medicines, but just some natural agents.
All right. I think those are some really helpful tips. I don't think we have any more questions. So, Dr. Akriti, if our community needs to reach out to you, where can they find you? What is your handle?
Yeah,
Where all?
you can just tag my this Instagram handle, and if they have any things, even I give online consultations. And otherwise, if they want to reach out for some other reason as well, they can just reach out to me, DM me, whatever they want to talk about.
Right. So, guys, we'll have Dr. Akriti's handle linked to the IGTV. We're going to save this live session so that you can go back and check out everything that we've discussed. And Dr. Akriti, thank you so much for being a part of this.
Thank you so much for having me.
And I'm sure our community has, learned so much from you today. And we look forward to many more sessions like this. And we're wishing you a very happy Women's Day in advance.
Thank you, and everyone who's watching this.
So thank you so much for this. And thank you everyone for joining in on a weekend and, coming for this live session.
Okay, see you.
Bye-bye. Have a nice day.